Now we've got this flashing alert. We come over and open it up, and basically all of the information that EMS had filled out is now visible to you in this form here. You can see it looks a little different on the hospital side. So again, we said it was low priority, 45-year-old male patient. We did allergic reaction for the chief complaint, did some of the vitals over here. So all of that information's there. And now you'll see there's this flashing acknowledge EMS button at the bottom. So when EMS sends this in, they don't know that you've actually received it until you click this button. So when we go ahead and click on that, that actually sends an alert back to EMS. So if I just bring the iPad back up, they'll get an alert to know that you guys have acknowledged their transmission. And again, that's important because, this isn't like a phone call where, you guys are having a two-way conversation. So obviously EMS knows that you're hearing everything they're saying. They're kind of blasting this out there. And then until you acknowledge it, they don't know that you've received it.